Welcome to the 7th episode of the Mindset Connection podcast. Remember, this is a show where we are showcasing everyday changemakers who are doing extraordinary things in the field of mental health and wellness. So we are your hosts, Jennifer Clearwaters and Cindy O'Connell, and we hope that you are finding our guests just amazing and inspiring, just like we do. So today we are happy to announce and welcome our friend, Dr. Emily Bessemer, to the podcast. Thank you for being here.
Thank you for having me.
So I'm going to give you a little bit of a background about Emily before we jump in. So Dr. Emily is a pelvic floor physical therapist who specializes in allowing patients to connect to their womb spaces, pelvic floors, cores, and energetic fields. Dr. Emily graduated in 2014 with her doctorate in physical therapy. She continued her advancement of studies in women's health through her certificate programs in pelvic floor rehabilitation, lymphatic massage, craniosacral therapy, Reiki master teaching, yoga trainings, which is over 1,000 hours of study, which is a lot, and meditations and trainings that allow her to integrate mindfulness and meditation and movement into all of her work. Dr. Emily's first community cultivation began in 2015 when she started her yoga teachings for the public. And throughout that practice, she noticed a need for integrating energy work, movement, and mindfulness into physical healing practices of pelvic floor work. So in 2021, she opened Embodied Physical Therapy. And since then, over 1,000 women have come in to work with Dr. Emily in the form of classes, sessions, and other types of healings. So Dr. Emily's belief is that we all expand and grow together. So again, welcome, Dr. Emily, to come and share all these wonderful things about what you're doing.
Thanks, guys. I'm excited to be here.
Yeah, we're excited to have you. So we're going to jump right in with a few questions, just a few. So how did you decide to become a physical therapist? So what was the impetus for that? And then specializing in pelvic floor work. So how'd that all happen?
Okay. So unlike a lot of people who got into physical therapy, I actually had no idea what physical therapy was when I first went into looking into it for school. So I knew I liked yoga. I knew I liked energy work. I had done some when I was really young. I wanted to do something that movement and mindfulness and connection to self was a big part of the practice. And I wanted to do something in medicine because I just loved the idea of being in the healing arts. And happened to be in undergrad and applied to one grad school, which I happened to get into. I was like, we could try. Let's see what this is. And I get there and I realized that I really didn't know what I was getting into. I never played a sport. I had never had an injury that I needed physical therapy for, but I had gotten in, so I knew there was a reason to be present in the programming that was there. And then by the end of my they go in like 3 years is physical therapy school by normal. By the end of the third year, there was one day on women's health, which is like just emphasis on we've evolved since then, but it's a newer part of physical therapy. By the end of grad school, there was one day on women's health, and the teacher was talking about how it could fix things like having bladder pain. And I was someone who had been diagnosed with interstitial cystitis or bladder dysfunctions, and I wanted to learn more about it. And I had that light bulb moment where you're like in the right place at the right time. And I knew I needed to know more. And so at that time, I had to go to Boston for further training. And so I went to Boston. I took classes with Holly Herman, who now has like a whole institute you can certify through. And it's been history ever since. I've been loving and grateful to do a job that I personally got to benefit from, and then continue the education of more people of what we can do in physical therapy for women's health and pelvic floor health. So
wow, what
incredible.
A journey.
Oh.
Yeah. So it's so interesting to me because when you said you graduated in 2014. So yeah, how much has evolved since then?
So
You're exactly
much.
right.
Yeah.
Emily, I just have to say, this is the first time that I've met Emily. Her energy fills this entire studio.
Yes.
So
It
I hope you
surely
can
does.
feel it.
Oh, thank you.
So I remember Emily and I took yoga teacher training together, and at that time you were working in the hospital, and I had a different job, and some other people that we in our group had different jobs, and we always kept saying, someday we're going to open our own place. Someday we're going to open our own place. And now you have this magical place that's just for you.
Yeah.
So what is it like working primarily just with women?
Oh, gosh. I mean, it's a multifaceted space that has been in the works for a long time. Working primarily with women has brought, just for me personally, a lot of evolution around some of these things that we don't really even notice are going on in our lives. So for instance, cycle awareness and menopause and perimenopause and things that we like don't talk about out loud all the time get brought up all the time in my office, because we feel comfortable when we're around people undergoing the same things that we are. And there is a level of ease and comfort when you're with people that are going through the same things as you the whole time. My practice geared towards specializing in women when I realized that was really what me as a person was here on this planet to do. I have been working primarily on menstrual cycle health and perimenopause and menopause transitions for the last 2 years. And that's when the practice really got into pregnancy awareness and prenatal yoga and really creating a safe and sacred space around that. And it's been just a magical transition. Yeah.
That's good.
Yeah.
What do you think that your patients need more of? They come in and talk to you. Rest.
Yes. Everybody does.
From a physical therapy perspective, there's a lot of manual therapies, like hands-on work that we do in pelvic floor therapy that is not addressed with your primary care provider. So there is some components of working on muscle tissue that we don't get to really have anyone look at unless you're going to a pelvic floor therapist who specializes in this type of manual therapies. But globally, I think the number one thing women need, especially we're filming this during a holiday season, there is the magic of mom that goes totally missed during a lot of this time, and rest and taking care of yourself and feeling in a space where you can slow down and calm down is, I think, just the best for everyone.
Yes. And doesn't always happen.
No. And so the office is designed that you can walk in and you almost feel like you're at home. I have the ambiance of the space is meant to feel really comforting and safe, not like walking into a clinical practice at a hospital setting or where you're really looking at white walls and it's very clinical, and it's very homey and comforting, for the idea that the more we can relax and snuggle and take some rest breaks, the more likely your body will also allow for some healing to happen. And so rest is my number one, if anyone takes anything from this.
And it's so true. For any of you who've not been to Emily's space, that's the energy there. It's comfortable.
Exactly.
Yeah.
So, this is a little off script.
Oh, yes. I love it.
So, do doctors recommend women to come to you, or is it self-referral, or how do people come to you? How do they find you?
So in my practice, most people, it's word of mouth at this point. So most people find me based on that their friends have come, or they've taken a prenatal class and they want to see me postpartum, or they're having pain and they Googled it and I came up and they read reviews of what I do. I specialize specifically really in energetics and pelvic floor health. So I see a lot of women undergoing major transformation, whether it's the transformation of perimenopause, or it's the transformation of birth, or it's I opened a business and now I don't know what I'm doing, which we've all done that.
We've all been there.
So the energetic component behind the creative center that is our womb space is where I really dive in. And so a lot of people find me that way. You can get referred to pelvic floor therapy by a physician or a practitioner, particularly a midwife or an OBGYN. But because physical therapists have their own doctorate, we're not required referrals anymore. That's part of the cash-based provider MO is that we can see you and help you and do all the things without needing to worry about getting referral sources.
Right.
Yeah.
Great.
Wow.
Thank you for that. Yeah, that's great to hear.
Yeah.
So yoga teacher training.
Yeah.
What made you decide that you're going to add yoga? I mean, I know you're talking about energy and you're talking about movement and mindfulness, which is all involved in yoga, breath work. But what made you decide?
So I started taking yoga when I was 16, which like now is 20 years ago. And I always loved it. I was never a sports person. I was never very competitive. And I don't know if that was just because my personality type is like, oh, I'm not going to win. I'm just not going to do it. Or if it was actually that I liked yoga. Either way. So yoga was always my chosen form of movement. And because of that, I knew that I would integrate yoga into what I do as a physical therapist. That was like kind of the first initiation of this is the type of movement I like. This is what we're doing. And then I took a yoga teacher training. Gosh, this one like 10 years ago, and then another one with Jen because that was my second
your
training.
Second one. We thought you were crazy for doing it again.
I am always. I love if there is one thing you can learn about me in particular is I love classes. I love trainings. I love learning new things. I think it's just we're all here on this planet for such a short amount of time, and I want to learn as much as I can
100%.
about everyone and everything. And so I took another yoga teacher training because we were here and some of my friends were in it, and I wanted to go play. And so from there, my office space, there's a woman, her name is Katie Morgan. She hosts a yoga teacher training at my office. And I talked to her about how I didn't really feel like writing my own yoga teacher training, but I would love to teach anatomy because I believe really strongly in anatomy and energetics, and yoga is the integration of all of those things. And if I can add something to a yoga teacher training, I know I can talk really well and really strongly about anatomy and energy. And that's kind of how it evolved.
Okay, so you're part of the whole teacher training.
Yeah.
Doing that. All right. So this is a little off subject, but it's actually not.
Yeah.
So I think that a lot of people come to you that have other concerns, like people that are battling cancer or a serious illness. So tell us a little bit about that. How do you work with those people?
Yeah, so there's a variety of techniques that I offer as a practitioner. Depending on the person coming in and what they're looking at achieving while they're with me will vary what we end up doing. But most of the time, if someone's coming in with a lot of complex issues, I really spend a lot of time just listening to them. You'd be amazed. I mean, maybe you both won't because both of you do what you do for work, but you'd be amazed how many times people have gone to a practitioner, told their whole story, and then no one actually listened to what they were saying. So
we know.
And so taking the time to really listen to what a person is saying is a lot of what my primary steps of figuring out how to help them are. Then we normally dive into something along the lines of like craniosacral or energy work first. I do something called it's Arvigo abdominal massage. It's a Mayan traditional technique depending on what's going on within their bodies. And yeah, it's a lot of we'll figure it out when we're together kind of things. But part of that is because I really try and take time to listen to what the person in front of me is reporting. Protocols, there are many that come up for, again, a variety of things, but sometimes someone's not appropriate for a certain protocol because of how they're feeling. We want to really emphasize, and I hope this is the transition that we're noticing in holistic care, is that as someone comes and tells you a story, you actually take it in and listen to what they're saying, and you're not just thinking about what's the first step that we're going to do after they're done talking. So that's,
staying in the present moment instead of thinking ahead as to what we're going to do next.
Yeah, where will we go? What are we going to do? How can I, and I teach Reiki trainings too. I actually just taught one this last weekend, so I think I'm still in the headspace of that.
That's coming next.
Some of the energy work that we do in the type of energy work I provide is about taking the practitioner out of it. So like, I am not the person that's going to fix this person. I am the person who's creating a space and creating comfort and allowing their body to speak the medicine that it needs so that I can then help them figure out how to treat and take care of themselves, which I think is really like a missing link in a lot of care.
Definitely.
Well, yeah, because at the end of the day, you're the one that has to change.
Because
and
you're
the one that has to do
they spend
the
an
work.
hour with you,
Yeah.
but they have the other 23 by
Right.
themselves.
You have to
so
do
they
the
have
work.
to they have to know, what do I need to do?
So the technique that I most love working with is called holistic pelvic care. There's a book called Wild Feminine. It's written by Tammy Lynn Kent. She's my teacher. And in this protocol, it's a hands-on manual work and a guided meditation practice that the person who is on the table can also replicate for themselves and be able to really listen to what their body is telling them versus having a practitioner be like, this is what your uterus needs, or like whatever body part we're talking about.
Right.
I find that to be the most gratifying when it comes to like really seeing care happen. Yeah.
So you're really looking for people to develop their own therapy.
Yes.
So
I know I'm doing my job when someone doesn't need to see me anymore. They just want to come to yoga, which is also why yoga started to happen at the office, was because I had so many patients that loved seeing me and loved coming in and felt really good. And I wanted a safe space that they already felt comfortable coming to, that then they could move their bodies and do it themselves without the need of me intermingling my energies with theirs to get there.
Yeah. And if you haven't been to yoga and you're curious about it can be intimidating to think about, I'm going to go to a regular studio and walk in and not know anyone, not know what I'm doing. So maybe starting in your space, which is comfortable and familiar, and give people
my office,
chance.
The clientele that come to my office have a variety of things going on, complexities, cancer diagnosis, or, sexual abuse, and things that their bodies are working through, loss of baby, having baby, like all things that are beautiful and big and scary and sad, and the wide range. And with that, going into a class where there are 40 other people in class can be overwhelming for their system. So the office is designed that the classes are really small groups. So it's 6 to 8 people max in a class.
Very small.
And that's they're designed that way so that people can go with this like small group private feeling of knowing that they know who's going to be in their class for the next 8 weeks. They know who's going to be the teacher for the next 8 weeks. They know where their spot is going to be. Because all that stuff matters when you're trying something new, especially when it's new in your body and this is the first time you've ever been comfortable in your body. We want to like really create a safe environment for them.
Emily, you have a great grasp of how to make people feel at ease. There's no question.
Thank you.
So,
It's so good. So let's flow into the next practice of
Yes.
Reiki.
So
you and I took Reiki trainings. Like, you are a master practitioner. You made me a master practitioner. And I know, I use it in my practice all the time, but a lot of people don't know what it is. So can you tell our listeners, what is Reiki and what does it do for you?
So Reiki is it could be a long story that I'm going to try and make really short, but Reiki is a Japanese energetic healing technique that works on creating environments, creating energy fields that allow for feelings of safety and healing and transmuting different things through the body. Energy work overall is about becoming a conduit for like universal energy to kind of pass through the practitioner to someone. And without getting into like a total thing that everyone's going to be like, let's skip to the next episode. Without getting into that, where it's really just about that same feeling you get when someone gives you a really good hug. So when you're around someone and they hug you and they make you feel safe and comfortable, it's about providing that kind of energy for someone within your sphere. And I think that Reiki is one of the many tools that we use as humans to make someone feel safe, and also a really great one to utilize. But it is about channeling energy from outside of yourself so that you're not pulling from your own reserves to give to people.
Yes, very true. And you're right. When you're done with a good Reiki session, you do feel like someone just hugged you. You just feel reset.
That like comfort of being like really seen and safe and held is really what I would say, goal of bringing
Yeah,
in.
it is magical. It really is.
I feel like being around Emily is like a warm hug.
Yes.
Aw,
yes.
thank you, Cindy.
Yeah, like
That's
so I
why
can
there's
see.
not many people like
No.
her.
Yeah.
So you can see it. If you're watching this, you can see how she lights up the room.
Exactly.
Oh, thank you.
Mhm.
So we're gonna switch again.
Yeah, I love
And
this.
although I feel like I'm really curious what the answer is going to be for this,
Mhm.
how do you handle the pressure of
Mm.
running a business? I mean, do you ever feel like it's pressure?
Oh, yeah. I
Oh,
mean,
okay.
I think that
We had that
Um,
idea. Start your own place, but
yeah.
it's actually work.
Yeah.
Oh my
Oh,
gosh,
wait, I have to
like,
pay
I actually have
bills.
to
I have
do
to
it all
the
this.
myself.
IRS is a thing. Like, I'm just like, what is that? Yeah. So, it's a twofold. So on the first side, owning my own practice and creating a safe space and doing what I want to do and love to do every day is, I mean, a dream come true. It is so wonderful and so amazing. And with that, because I love it so much, I tend to overwork a lot. So my biggest challenge with running a business is learning how to say no. As a
Mm.
recovering, I hope, people pleaser, I tend to be like, oh, you need me. How can I like, oh, we need to get in. Of course. Like, what do and that has been, wow, what a learning curve over the last few years of how to really stand up for boundaries and
Mhm.
comfort. And when I'm my most embodied and boundaried self, I am the best provider.
Yeah.
And that has been an interesting learning curve.
Mhm.
How I handle the stress of business, I try to make sure to eat 3 meals a day. Sounds so simple, but when you're running a business, you get
Mm.
confused. There's like, oh, breakfast and like lunch and like running through. So making sure I try to eat 3 meals a day, drinking plenty of water, and I take off every new and full moon from the office. So I make sure, because there are days on the calendar that I can see, I practice women's health and cyclical regularity. So with the cyclical cycle of the moon, you can really replicate that in your daily life. So I really try and take off for new and full moon from the office where like I am unreachable and we are closed. Whether that
Mhm.
happens all the time, I will be full disclosure and authentic that might not be the case, but I really try. And I mark those 2 days as like Emily is unreachable on those 2 days, because that was kind of a way for me to buy into my own stuff that I'm
Yes.
doing already. So I am excited that I'm here and I'm doing things, but also like we need to make sure to mark days
This isn't
off.
a full moon, is it?
No,
Yeah,
this
almost.
yesterday
Close.
was
Just
the new
close.
moon.
A new moon.
Yesterday
A new
was the new
moon.
moon.
New
Yeah.
moon.
Yeah.
Yes, yes.
And I also don't think
Mhm.
this really counts as work, guys. I'm here hanging
Okay.
out.
Yeah.
Okay.
But you are
And-
it's very easy for you to overwork.
Totally.
Yeah.
Because
And-
I
and-
love it.
Yeah, and you
know?
feel bad. Oh, someone needs this time or this time. Okay, I'll do it. And
Oh,
then you're
okay.
running
I could see
yourself
that.
to the
Yeah,
ground.
Yeah, yeah.
Definitely
Yeah.
see that. So, what are
Yeah.
your rituals? You know, we're big on rituals.
Yeah.
Are you big on
I
rituals?
am. I
All right.
love
I'm
them.
Not surprised.
My morning ritual is I meditate every morning for 20 minutes, and like meditation can look like for a variety of things for me, but the morning meditation practice is I sit with my cats and I snuggle them, and they are like my cute little fluffy besties. And then I really try every day to I set a space in my office. So when I come into the office, I will call in the directions, which is like a way of practicing
Mhm.
setting a space. And then when I leave, I release them. And I also say a little prayer, mantra, statement to myself to collect all of the energy I've given away and send back all the energy I've picked up along the way. And that just gives my brain and my body the signal like now's the time that we are no longer at work. And then my number one best thing I ever did was I have a completely separate work phone, and that's where Instagram and social media live. So Instagram and social media do not follow me home. They live on the cell phone that is my office's cell phone. And the cell phone was important because you guys probably also have this too. Patients like to text now, and I love having the option for them to text me,
Yeah.
especially if I have a newly postpartum
That's a great
mom
idea.
who's up at 3 a.m. Like she can shoot a text to that office phone. I won't get it until I'm in the morning. It's not a problem. And also, it keeps social media out of my personal life, which is wild to think it's infiltrated so deeply. But having that clear, like, it is not on my phone really helps me from using it at home. Like, it's had to be like a strong disconnect.
Very strong boundary.
So it sounds like you do a check-in in the morning and a check-in in the evening.
Or even a check-out.
Or check out. I was going to say check out, but I didn't really quite want to say check out.
Because when you're checking out of the office, you're releasing everything that you've brought in during the day so that you can just move on with the day.
Yeah. And for when we talk about energy work and when we do energy hygiene practices, wanting my energy body and wanting their energy body each to ourselves is the only way people can be better, and why we want them to have all of their energy too, and I want to have all of mine. So that gives me this like momentary pause of even just noticing like, ooh, I don't have a husband or a dog, but I'm really worried about mine. So like, whose are these? And like sending them to where they belong, kind of thing.
And that's important. We remember talking about this in Reiki training that we did. At the end of the day, these energetic practices to like send everything back where it comes from is important. And almost like the washing, like I shower at the end of every night just to get the energy off.
Hand washing is another big one, like really taking the opportunity between people that you're seeing to wash your hands, envisioning in your mind, like rinsing anything that you've picked up and like need to wash down the drain can be really beneficial of just clearing out space. Yeah.
And that's also a mindfulness practice, is to actually pay attention to the washing of your hands. So, you actually just did a reset by just paying attention to that little act, which people don't realize how they can intertwine that into their day.
And I think that's also why like eating 3 meals a day is not just like, you're not just nourishing yourself, but like really sit and pay attention to eating. Like take a moment to like feed your body, drink some water, and like feel yourself drinking water. You don't have to just rush between all these different things. Nourishing your physicality is really important in the work that we're all doing.
And that's a big area for not just our professions, but like so many other ones where they feel like they don't have time to sit and eat. We see this with the medical staff. We see this with the teachers. We see this with the lawyers. Like the day goes by, or they're running down the hall, throwing something in, or we get to the end of the day and realize I haven't had any water today. And I feel like so many professions are geared to work their employees like that.
And if you even think about your own body, when you're hungry or thirsty or tired, you feel like fritzed, like you don't feel fully yourself. And so it takes a lot longer to get things done when you're also hungry. Like you're just I know me, I call it fairy brain, but I think it's whatever. I know me, when I'm not nourished, I'm thinking about 1,700 things at once and doing half of one and then going to get this and then doing. But when I sit and eat and recalibrate and nourish myself and feel really grounded in my body, I get a full task done. I feel more accomplished. My focus is stronger. I can be present for someone rather than thinking like, oh, I really have to pee. There's like a lot of things that are part of that really make a big difference.
Yes, they really do.
You just touched on it. You said about being tired. So tell us about sleep.
Oh, sleep. I am a good sleeper. I know that's like a tough topic. I love sleeping. I think I'm a Taurus. I am an earth sign. I sleep between 8. I definitely get a solid 8 hours a night.
Good for you.
I have a sleep hygiene routine where I take a shower or a bath. I try and like rinse off the day. And that is, but because I think I am doing so much every day and love what I'm doing and so involved that by the end of the day, I'm just, it's time for bed.
Gotcha.
It's good that you see that. But okay, so let's switch back to the business. And we talked about this a little bit earlier, but like over the years, you've expanded so much of what you're doing. It's not just coming in to work with Emily. Now you have classes, if you haven't seen the class schedule, you have
Yeah.
things posted out all the way through the new year, and they're all
Mhm.
different kinds of everything.
Mm-hmm.
So how did you decide like what you were going to offer
Yeah.
besides yoga? Because like
Yeah.
that was already like in your nature to offer
Mhm.
that. But besides the yoga classes, how did you figure out what you wanted to do and who's going to actually teach it?
Yeah. I think this ties back into the like, how do you treat patients? But because I was listening to what people were coming in with, I knew things that I would want if I was going through some of the things that they were having. So the classes, yoga was a given because I teach prenatal yoga, and I have my friend Karen, who's a midwife, who teaches prenatal yoga with me. And that was something that I knew we were going to have. And I specialize in movement, so I needed some sort of movement classes on the schedule that I taught.
Right.
And then I was listening to the people coming in, and there are people who are scared to move and scared to participate. And, you know, it's a part of a fear that blocks them from joining in programs. And I'm working with, as you all are too, I'm working with a lot of people who are going through some really big changes in their lives.
Yeah.
And sometimes that barrier can be that there's such a big change that they don't even really know where they are in space anymore physically. How can we provide them a safe space to come and participate in something? So that's where a lot of the ideas for classes have come, is from people, what they've prompted me with in terms of questions.
Okay.
And then the people who teach at my office are all people who have honestly asked me about what I do and have bought into what we do in the space. And most of them are all trained in a variety of mental health or social work or something that I know that the safe is safely being held as a container that doesn't involve me.
Mhm.
So most of the teachers at the office are in some way trained outside of just a yoga teacher training on how to hold safe space. Because that's, as a physical therapist who does small group classes, that was important for me, for them to be able to do. Yeah. And
So
that's
they
kind
all
of
have
how,
found you.
yeah, they've all found me.
That's amazing.
Yes, everyone has found me, and they're all people that I would go to for trainings and teachers and classes.
That's
so
important.
before I ever have anyone come to the office to teach, I take their class. Like, I love them. These are my friends. They're wonderful women who have done a lot of really wonderful work in the world, and they just so happen to also be open to teaching a class at the office. That was something I think the patients could benefit from.
It sounds like they all share your vision.
Yeah.
Yes.
Yeah.
So, yeah.
Because you can't just have just anyone
No, you
No,
can't.
to teach.
no.
Even if they were highly trained or they sound
Totally.
great on paper,
Mhm.
the people that they're working with are a special group.
This space is a collective. So the people who come and teach at the office don't work for me. They all own their own businesses. They all have their own values, but their values correspond with mine. So it's safety first. It's patient, client, whatever you want to call it, driven. And it's around how can we help people evolve? Like, how do we help people feel really good in their bodies to a point that they like want to try that new art project, or are open to like being quiet and listening to bowls, or talking about the yoga sutras, things that most like exercise driven spaces aren't really thinking about, because it's not always about the trauma, making sure someone who's had trauma feels okay.
Yeah.
And so it's really, that's kind of how the space has formed into how it is. Yeah.
And it's going to keep going.
Yeah. And I'm grateful because I can't do it all myself. So I really needed people to come in, and they just happened to come at the most opportune and beautiful time. So I'm just so glad to have all of them.
It's
too.
good. What do you think is next for you?
Gosh, I don't know.
You have any ideas? Any ideas?
Uh-oh,
that
maybe
you're
something
thinking of?
will blossom right here.
I know. I am currently in the process of working on it's a menstruality leadership program. So it's It's about cycle awareness and looking at your cycle, whether you have a menstrual cycle or you've gone through menopause or are going through menopause, and correlating with the moon cycle, and how we energetically and physically feel, and how we can use that as ways to grow our businesses, grow our lives, feel confident as we're speaking in varieties of ways, and helping women really understand how we are cyclical beings. And part of that means that you can't show up the same every day, and that's a good thing. We're not supposed to show up exactly the same every day. And so in the 2025 year, that is where I am focusing a lot of my educational energy, and that's about where I think we'll hopefully settle for a little while.
That's wonderful.
Yeah.
Because we always need to look at what's the next thing.
Yeah.
You know, and people who are like constant learners, like we are, we're always thinking, what's the next thing I want to do?
Yeah, that I am hopeful becomes more of a virtual type of space, because
That's
I
what
think
I was
that there's
thinking when you were saying it.
because I think there's a lot of people that, because I am a brick and mortar and I'm a hands-on therapist, there's a lot of people I would love to work with that would love to work with me that can't get into the office. And so I'm hopeful that this allows me the opportunity to work with people all over to come and learn about their bodies and feel really safe and get movement practices from afar. So that's really my future goal.
I love it.
So how do you view failure?
Oh, I mean, failure is part of everything. So like I said just a minute ago, we are all cyclical beings. And part of that cycle is that sometimes things just don't work out. And if we held on to this stuff that wasn't working, then it holds us back from the next thing. And also, if you're not failing at some point, you're not really trying. I mean, the only way to continue to move forward is that at some points in time, you're just not going to hit that mark. And that's okay. That's kind of part of it. Life will have a weird way of throwing curveballs in that we are not fully expecting. And sometimes that means that we have to say, ooh, I thought this was a good idea and I'm changing my mind and it's not. And I think that for most of the failures are really just reorganization. We're reorganizing what we're doing and where the priorities are. And maybe it was one thing and now it's just not that thing anymore. Yeah.
And you don't
Room
need to hold
grow.
on to it.
Yeah.
Right?
We can let it go. How amazing that there is, just like the ocean, it comes in and goes out. We just gotta let it, some of it's gotta go, and that's okay.
That's okay.
So what are your three most important strengths? I mean, I know you have
lots.
So many.
Oh, thank you.
But what are your three most important that come to mind? Don't even think about it. Just spout it out.
I think my willingness to learn, as I said, it's my favorite thing is learning. And I feel like the willingness to learn and learning about people is great and a real strength in my practice. Not taking anything personally. That was a learning curve that I really had to get over, especially when owning a business, when working with people. That sometimes they just don't do what you want them to do because they just don't. It has nothing to do with you. And in my personal life too, we could get on a whole different tangent on that one. But just not taking things so personally. Right. And I feel like I want to say going with the flow, but that is not me at all. That is an ideal that I have. So authenticity.
That's on your wish list.
That's
on your wish list.
We'll say being authentic is another one, because that'll be I can fully see that is, there are certain things that I would love to have, and also that I think that's a good one.
Right.
Last question for
Is there anything else that she wants to, and then I'll get on to my three questions. Anything else you want that we missed maybe that you want to just share with our audience?
Yeah.
I don't think I have anything in specific other than just because it seems hard and it seems like something that is not a reality for you doesn't mean that it's not a reality. So I would have never thought that this would be where I am right now. I would have thought that I would have to make money as a physical therapist, which is what I went to school for and I graduated as. I would need to work in a clinic or in a hospital to do what I went to do or why I did it. And I just think that something I would hope that people get from either our conversation or just like within themselves is that you can do anything you want to do.
Mm-hmm.
You really can. And it seems crazy. And yeah, it probably is. I mean, you just had someone on your podcast talking about periods and energy work. Like that's not one that, you know what I mean?
Goes together.
And like that is the reality. We are changing and shifting, and our world is changing and shifting. And part of that is that if you dream it, you can do it. And I am so grateful that I've been able to risk a couple things and change a couple topics and have a bunch of failures that have brought me here right now. And just because it feels bad sometimes doesn't mean that it's part of the whole process.
I love that.
Yeah.
So good.
Yeah.
So how can people find you and learn more about you?
Yeah. So the best way to find me is probably through the website, which is embodiedphysicaltherapy.com. I regularly write Instagram posts, although I made the comments about social media. I don't regularly respond to DMs, so try not to DM me, but you can email me and I will get back to you always.
Mm-hmm.
But the Instagram is Embodied Physical Therapy, and all of those posts are written by me. They're timed out so that they're like coming out every week, and that's where you will also find all of our classes at the studio. So anything that you're interested in seeing, if we have sound bowls and conversational groups and donation-based breastfeeding support groups and all sorts of things. So please feel free to follow the Instagram, because that is not just me. And then, yeah, I think that probably covers it.
Yeah, your website is very extensive.
Yeah,
Mm-hmm.
yeah.
So these are 3 questions that we ask everybody. Depending on your first answer is whether I'll ask the next
one.
2. So is there something you want to change?
Always. I feel like if we're not changing, we're not evolving. So I don't have
Always is not an answer that we've gotten before.
No, we haven't.
And
Not
we've
always.
asked this to
Lots and lots of
close to
people.
1,000 people. So
I don't know if I have anything specific that comes to mind.
It's okay.
But I think that when I think about life, I think about a spiral, and there's something always changing, and either we go with the flow with that or we resist it. And
but you don't go with the flow.
I don't go with
So you might be
Sorry, I
I'm
had to
hesitantly
I
going.
had to interrupt you
crying
because
on
I'm
my
listening.
raft of moving. But yeah, I mean, there's always something that I want to change, because I think that that's what keeps us evolving.
So, now if you had said there was something specific, not that we want to know what it is,
Yeah.
but the next question would be, what's holding you back?
I guess time. I feel like the time is the big one that tends to hold me back from a lot of things, because I love what I do so much. I love dedicating my time to the things that I'm doing, and I don't always have a huge, infinite amount of time to commit to changing something else. But yeah.
Okay. And then, the final question is, and you don't have to answer this one, is what's one step you can take to move forward towards a change?
Yeah.
So you just said time. So what could you do?
Yeah. So as I had talked, hinted at, as I work towards creating more virtual programs, I hope to reach more people, and in turn create more time with programming that they can do without my physical presence being a part of that time.
Yeah.
And then as that evolves, who knows? But that could be one.
So I'm just going to ask you this, just because as I'm thinking about it. So when you're saying virtual, are you going to be live, or is it going to be
all of the things?
Okay,
yeah.
So you would be live, so everybody logs in at 5 o'clock and sees you,
Yeah.
and okay, all right,
yeah,
great,
yeah.
I love
something
it.
to look forward to.
It is. Yes, we will be
Yeah.
anxiously awaiting.
Yes.
All right. So we are wrapping up another episode, and thank you for being on our podcast, Emily.
Yes.
So wonderful to have you here. And thank you, everyone, for letting us be part of your wellness journey. So tune in for another episode and learn about another amazing guest that's going to be doing lots of things to change the health and wellness field. So if you want to learn more about Cindy or about me, you can go to our websites. My website is www.mindsetnj.com. Cindy's website is www.mindfulnessconnection.com. I'm on social media at Mindset Gem. Cindy's Instagram is at Mindfulness Connection. We have a YouTube channel at The Elevation Principles, and our book, The Elevation Principles, is available on Amazon. And just one more note, this podcast is produced and recorded and edited at Black Swallowtail Studios here in Eatontown. They do an amazing job, and we always want to let them know how appreciative we are of all they're doing for us. So thank you.
Right. Thank you so much, Emily.
Thank you.
Thank you.
Very inspiring today,
Mhm.
for sure.